We're in Lewistown, Montana at the Central Montana Medical Center. Lewistown is a town of about 6,000 people. It's actually right in the center of Montana, the geographical center, and it's an agricultural community. There's a lot of cattle ranches around. There is some farming.
Can I listen to your heart and lungs?
I joined the TRUST program and graduated from the University of Washington in 2012.
Can you lean forward any? Thank you, sir.
TRUST stands for Targeted Rural Underserved Track, and it's a longitudinal program that lasts throughout your 4 years of medical school. It's integrated into it. You do training before you even start medical school in that community, kind of get introduced to it. And then after that, you come back several times during each year, and then in the summers between. And then during your third year is when it kind of all accumulates, and you do 5 months here, and you do all of your outpatient medicine in that community.
Does she mind her tummy time?
Dr. Bennett has been a mentor for me over these years.
There we go.
Actually, she's always treated me like a colleague.
So we like to go right on the skin.
She's always asked me, what I felt we should do in a certain situation, or if I had any other ideas, or if there was something I really felt strongly about, a way to treat someone. She always wanted me to pursue that.
Not bad for a 78-year-old woman.
Pretty good, I would say.
As I've seen that longitudinal education process progress, I think that is truly the future of medicine. I think for medicine anyway, but I also think for especially rural medicine, because the only way we really can have good quality health care anywhere in the rural U.S. is to be able to give young doctors the confidence and the knowledge of what it's like to be out here, and the excitement and the relationship, and why did they go into medicine. And honestly, it's a lot easier to do it in this kind of setting just because they get to see it in place.
I like being able to know families. I like to know, that I've delivered a baby, and I get to see the baby and the mom, for months afterwards, and then I know their grandma, and I know their, uncle, and you learn a lot about families, and you learn a lot about their social life, which is really important in medicine. I grew up on a ranch in southeastern Montana, pretty remote, about 50 miles from the nearest town. So I actually went to a one-room schoolhouse. The people in small communities are just really loving. They help each other out because you don't have anything else when you're out there.
Take a look at your legs.
I knew I wanted to come back and be one of the people who, help people when they're at their lowest or highest points in their lives, and just give back to the community.
We'll take a look, make sure you're on some blood thinners.
Oh, she's going to be a great doctor. She's going to be wonderful. I mean, she's confident, she's not afraid to work, she's energetic, but she is unbelievably empathetic. And the patients just her being here, the patients go, gosh, I sure like that doctor. She really talked to me, and she really told me things, and she has that wonderful skill of being able to educate patients too, because that's a lot of what we do.
I think the TRUST program is just a very unique program. There's nothing like it in the country for medical students. It's, it's one of the only places where you can really get to know a community and a set of doctors and a set of patients. And it's an opportunity for you to grow within yourself and learn about all aspects of medicine.